Welcome, Survive Outdoors, where we do wilderness medicine videos. We talk about getting injured in the outdoors, all different kind of critter bites, from spiders to ticks to mosquitoes, you name it. How you're going to treat that, what to do when you get back to base camp, or where should you go, urgent care or emergency room. Which reminds me, what we're doing is educational only. It is not medical advice. Take that home with you, right? It's not medical advice. All right, I was asked to basically, should you do a precordial thump? So what is a precordial thump? A precordial thump, precordial, the chest area, what they're specifically stating with that is, should you pound on the chest if someone's having a heart attack, right over this bone called the sternum. There's three parts to the sternum. This top part is the manubrium, the body, and then the xiphoid. That's a little sharp area down there. And your ribs attached to that. And behind that and underneath there, you have your heart and part of your lungs. Heart actually moves a little bit to the left, it's not in the center. So in the early 80s, back in 1980-81, when I was in some hospital training in New York City, I was taught this, and I've done it on one person in 43 years, is that you take your fist like this, and you basically pound onto the chest. You see this in the movies all the time, and it's very dramatic, and they come back to life. One of my favorites is Young Frankenstein, if you remember that one, and he kept beating the heck out of his chest. So that's a precordial thump. It was 6 to 10 inches above, and you bring that hand down. You don't raise your hands above your chest. You don't pull out a hammer and beat on them. And it's about just below mid-center of the body, of the sternum. So was this working? Did it help? Well, back in the early 80s, early 90s, we thought for sure it did. But just like anything else in medicine, things advance, more research, and we become better at what we do. In 2010, the American Heart Association said, nope, we're not doing that anymore. The results are really a bad outcome for the most part. So you can have a dysrhythmia where you can actually make matters worse. And with the development of AEDs, where you just bring in the machine and shock them, you get a much better result, and /or CPR. So, and you don't know what's going to happen in terms of like commodio mortis. Demar Hamlin, the Buffalo Bills, I think he was a running back? No, he was a defensive. The point is that this guy went down, it was all over the news, and that incident occurs when, mostly in baseball, hockey, and lacrosse, when you have something hit your chest, and it has to just moderate, it doesn't have to be hard, and you go into an arrhythmia and you have a cardiac arrest, not a heart attack. And that is what happened to Demar Hamlin, and thank God he made it. So what if you're in, God forbid, Wyoming, somewhere up there in the mountains, and you're with your partner, and just you and him, and he goes down? Do you pound on their chest? Do you give the precordial thump? To thump or not to thump? That's the question. And the answer to that is going to be, for me, a resounding no. You're better off learning CPR and doing that the correct way, and you have a much better chance. Now, yes, I know if you're by yourself and you're going to maintain CPR for a period of time, that is tough. At my age, I could probably make it 10 minutes, and I have done CPR a bunch of times, and it's tough to do. It's tough to maintain. It's exhausting. So two-man CPR would be much better. But if you're on a trip and you have some people that are high risk, and you're with, there's 5 or 6 in a group going on some 7-day trip out to the outdoors, I would really make sure somebody knows CPR. It just makes sense. These decisions are not made lightly. American Heart Association, they basically went through tons of studies. There's been tons of reviews on this. There was a journal in 2012 in the Journal of Emergency Medicine that discussed this in great detail. They followed 400 and some odd patients, and like 60% had VFib, and the 40% had aflutter, and there was really not a good outcome. In fact, some from a precordial thump had a dysrhythmia, which actually it made it worse than what they were in. If they weren't even in VFib, it did not have a good outcomes. So these decisions are not made lightly. There's a lot of thought that goes into this. We're dealing with human lives. So what's my feeling on this? No precordial thump, not a good idea, not advisable at all. All right, guys, keep your eyes on the horizon, your face to the wind, stay healthy and safe.